Hello there, welcome back to the program People, Politics and Power after the general election induced hiatus. I am Imoni Amarere. What they say is life. It may look so ordinary, but it is so critical to human existence. It is in fact at the center of humanity's economic and social development, so much so that communities and even nations have either threatened to or have actually gone to war over water. Like air, it is very vital to human existence. And the United Nations says it is an essential commodity for sustainable development. About 71% of the Earth's surface is said to be covered with water. Ironically, there is hardly enough to meet human and other needs. Water is so important that the United Nations in 1993 set aside March 22nd every year as World Water Day to celebrate water and raise awareness of the 2 billion people living without access to safe water. This year, 30 years after the institution of the World Water Day, the focus of the observance is on accelerating change to solve water and sanitation crisis. It encourages people to take action in either their own lives to change the way they use, consume, and manage water. In Nigeria, although about 70% of the population are reported to have access to a basic water source, more than half of the sources are contaminated. The UN says access to clean water and improved sanitation is a daily challenge for many Nigerians. It is estimated that about 26.5 million Nigerian children, or 29%, experience extremely high water vulnerability, as only 9 liters of water is available to a Nigerian daily. The result of these poor access to water is the high mortality and morbidity rates, especially among children. According to a new UNICEF analysis, 78 million children in Nigeria are at the highest risk from a convergence of water-related threats. Nigeria is one of 10 countries that carry the heaviest burden of child deaths from diseases caused by inadequate wash, such as diarrhea diseases. Nigeria ranks second with Chad on children most at risk in 163 countries as far as climate hazards are concerned. All of these underline the water crisis in Nigeria, and this is our focus on the program today. I'm joined in the studio by Dr. Jane Bevan. Dr. Bevan is the UNICEF Nigeria Chief of WASH. Thank you so much, Dr. Bevan, for joining us. Also joining us is Kolawole Banwo. Kolawole is the head of advocacy, Water Aid Nigeria. Mr. Kolawole, thank you so much for joining us.
Thank you for having me.
Right. So let's begin with you, Dr. Bevan. Tell us what the water situation is globally at the moment.
Well, I think World Water Day really is a very useful event for highlighting the issues around water. And I think with climate change, everybody is increasingly concerned. And I think we've seen already the impacts in Nigeria of extremes of weather. So that's increased rainfall, increased drought, increased flooding, and it's the same across the world. So there are huge challenges, and there are more people, which means more water needed and more water extraction. So the few water resources that we have, particularly groundwater, and river water, we really need to manage carefully. We need to sustain these resources, and we need to regulate the use of the water so that it's not over extracted and that we're left with none, which is a real risk.
Mr. Kolawole, the figures indicate that 70% of the earth is covered by water, yet humans are struggling with having water, enough water, access to good water for its needs. How has that happened? I mean, how come we have so much water and very little?
Okay, thank you very much. Well, the issue around the water crisis is twofold. The first is that water is not all water that can be used, okay, for some kind of purposes. I mean, you have water all over, but you know there's water with high salinity everywhere that you require a lot of resources to convert to usable amount. And so what we have basically in terms of water crisis is what we call economic scarcity of water, basically, globally, okay? Maybe in specific geographical locations they could have issues with any water security. But economic water scarcity talks about the inability of communities and citizens and governments to invest in the necessary infrastructure needed to extract water, treat it, store it, and then transport to the point where you can dispense to the final consumer. And that is why it appears as if it is scarce. You need to invest in infrastructure, you need capacity, because you can't just drink water for it to be safe. It has to be properly treated to be fit for human use and human consumption. And that requires huge investment, usually government-led investment. And because governments are around the world, especially in this part, are not investing sufficiently in those infrastructure that will make us be able to harness these water resources in a manner that they can become available for the end user, it appears as if there is scarcity. And that is why you have that data. So much water everywhere, but not enough to go around or to drink.
Dr. Bivan, tell us more about how water is considered safe, when water is considered safe.
Yes, so water quality is a huge issue. Often, particularly if there is uncontrolled, again, and unmanaged disposal of waste, pathogens can creep into the water, and particularly in the ground in the water table, and particularly fecal matter and E. coli is one of the biggest culprits for getting into water systems and making our water dangerous to drink. This needs to be regulated, but it's also the reason why more and more we do need to treat water. We cannot assume that drinking water out of a stream or directly out of a borehole is safe, and there are ways to test that. But as a precaution, I think everybody should be treating natural water before it's drunk. So diseases such as cholera can easily be passed through water supply if it's in fecal matter, and then that gets into the water circulation. So it's very easy to contaminate, very difficult to clean up.
So what is the relationship between having safe water and diseases?
So many diseases are related to water, even malaria, because malaria has to breed, the mosquitoes have to breed in fresh water, but diseases like cholera, like typhoid, like polio, they are all contamination of water supply through fecal matter. This is why sanitation is so important. We need to separate excrement from human consumption of particularly water, and why it's really important to treat your water with something like chlorine to make sure that it's safe for consumption, and particularly for children who are the most vulnerable to these diseases.
So Kolawole, I'd like to get back to this whole relationship between having safe water and diseases. In fact, there is this theory that, in fact, unsafe water could then generate all manner of diseases in society. And the fact that children are much more vulnerable to this unsafe water. How is that so?
Well, basically, first talking about quality of water and safety, what Jane has said is obviously the issue. But there are deeper issues around water in terms of the source from which you get them, and then the process of processing them to be available safely for the end user. Sometimes she's talked about microbial infection, pathogens and all, but sometimes also what makes water safe may not be so obvious, and that's when you have toxins, chemical toxins, metal toxins, lead, cadmium, high iron levels that does a lot of insidious damage because they may not be obvious. You may not fall sick immediately, but they continue to cause problems. And that is actually where, for me, children deserve more protection. And the reason is because their organs are still forming, kidneys are forming, and these are the things that are necessary for them to develop properly and grow to become very useful members of society. So if those things at those early stages, of course, obviously, children's immunity are the least, so they are very susceptible to infections. But in this case, as they grow, it may not be obvious until it gets to a point where development becomes stunted, and then you discover that developmental issues. And then organ failure and all of that, it becomes difficult to completely raise normal children who can be their best. So those also cause diseases, usually non-communicable diseases that affect a lot of children and even adults. For instance, you can imagine that trachoma is the neglected tropical diseases that can easily be taken care of by hand washing and cleaning. But it's also the worst leading cause of blindness. So you have a child who is exposed to that and is not able, he loses his sight as he grows. So that is the relationship. If water is not safe, it can be infected to cause diseases, and it can be polluted by other contaminants that can do damage to the bodily growth and development of young people who are in their formative years and who need very safe and clean water, both for consumption. There are also diseases that are skin related because you bathe a child with contaminated water. Those are the kind of things. So children are very vulnerable because their immunity is still low, and they are usually in their formative years where they need the best care, best facilities, and of course best water for use.
As you speak, I just try to remember when we were very young and we were growing up in the villages, and we were having to take our bath in streams. How dangerous is that? Because even as we speak, there are very many children, there are very many people in the rural communities who still have their only source of water will be streams.
Very dangerous, and the statistics are there. Many of the diseases that Jane referred to, that is how they get to, apart from the fact that even domestic use of water that gotten from streams that are not treated. And that's why she said, very importantly, that everyone should be encouraged to treat, and she used the word, I was watching, I was listening, natural sources, because in their natural state, they may not necessarily be safe. So when you bathe in the streams and the water is contaminated, I mean, you remember the lead poisoning in Zamfara, for instance. All the lead that did all the damage did not do damage directly to those who were in the mines. But because the environment and water bodies were contaminated, pregnant women were still using it, so they had deformed children. Children were bathing in those streams, so they died or became deformed. So that is just it. If the water is not safe, it may not be apparent immediately, but government and all stakeholders must ensure that we reduce this to the barest minimum so that we don't expose innocent children. I mean, you were bathing in the river innocently. Maybe you were not aware of the risk, but when we have more educated communities, parents should be able to let their children know that these are very risky. The effect may not be immediate. Down the line, it may begin to have effect. So it's not safe to bathe in those are primary sources of water that are unimproved. We call them unimproved. That is the least in terms of the water ladder. Unimproved, that are exposed, that can be easily contaminated, and that can cause diseases either immediately or in the long run.
But you and I know that in those rural communities, those villages, you cannot begin to think of treating the water in such streams.
Yeah, it depends on what you mean by treatment. And that's why we encourage basic treatments. Our communities are becoming wise. A lot of sensitization has gone around and people are improving. There are natural, easy ways of treating waters, easy boiling. There are a lot of education, and when you go to the primary healthcare centers with health education and all, people beginning to link water they use with the frequent visit to the hospital and incurring huge amount on hospital bills. People are beginning to learn that prevention is not just better than cure, it is also cheaper. It's taking time, but the message is getting round, so we're making progress.
Yeah, it is that time that is taken that I'm concerned with, because I mean, given the nature of our system in Nigeria, for instance, it's not that easy to get to those rural communities and get them to treat their primary sources of water.
It is easy if people will sit up and do their jobs. We have a federal structure.
That is if.
Well, then somebody needs to get people to do their jobs. You have primary healthcare center in rural areas. You have environmental health officers all over the place who have a duty to do this education and make sure people learn and communicate to them in the language, okay? Not do very bogus adverts and all, but reach them in their localities. We have the facilities. Maybe we need more people. We need to invest in all of that, and that's where government needs to come in, because I agree with you. We need to do more, but the people can be reached and it can be done if we just stand up. And that's why days like this are highlighted. We have World Toilet Day, we have World Water Day, all those days to highlight the need for all stakeholders. And if you know the thing, be the change. Play your part and play your role where you are, and just do your job. If government needs to increase investment to have more people doing it, let's invest in it, because when you have people falling sick and dying when there are epidemics, if life is precious, we must treat it as such. And water is one of the easiest way to make sure we communicate to the world and the people that we value lives as a people.
Dr. Beaver, the theme for this year's Water Day is Be the Change. What exactly motivated our theme?
Thank you for the question. So accelerating change is needed in this country if we're going to achieve the Sustainable Development Goals. The aim of the goal is by 2030 to have universal access. And with the rate of progress in Nigeria at the moment in terms of water provision, we're not going to achieve that goal before about 16 more years. So we're clearly not going to meet the SDG. We won't be far off, but we'll be off. So we need to fasten progress and we need to accelerate change. So that's the first change. I think the second change is the personal change, the piece that you can actually do. As Kola said, you know, every government official who has a role to play should be playing their part. But it's our own individual what we can do as well. Can we minimize our water use? Can we stop running the tap when we're not actually using it? Can we shower for shorter times? Can we wash the car with a bucket instead of a hose? Just things like this that really minimize our water usage to help everybody have enough to go around.
Okay, let's talk about the climate hazards that Nigerian children are facing. What do you mean by climate hazards, and how are children impacted by that? Mm-hmm.
So as I mentioned, you know, there was this Children's Climate Risk Index, and Nigeria was found to be the second worst in the world country for the quality of climate risks in terms of impact on children. And the risks are obviously related with extremes of weather. So we're having higher temperatures, we're having more and more intense rainfall, we're having longer dry spells and more intense droughts. And because of the intense rainfall when it comes, and coupled with issues like deforestation, we're having intense runoff and massive flooding. So we saw last year some of the worst flooding. Over 4 million people were affected by this flooding in the country, and it's not going to get better. It's if anything, if we're not mitigating against some of these risks, it's going to get worse. So children, of course, are the worst affected by all of these things. If there is little food to go around, it's the children that get malnourished. If there is little water to go around, it's often children, particularly the girls, who have to walk a long way to fetch the water and are therefore missing out on other things such as education, and so on and so forth. There are many ways in which children are affected by this climate disaster, and there are also ways that we can mitigate against this. So understanding these risks and being more prepared for them is really part of the work that I think things like the National Adaptation Plan need to build in to make sure that we're adapting to the changes and not being left behind by them.
Nigeria ranking second with Chad out of 163 countries.
Yes.
That are measured in the world. That's not a very good record to talk of. But what were the indices? What were the indices used in the measurement that placed Nigeria as second worst?
So it's a composite indicator, and I can't recall every single line on it, but it has things like the extremes of weather, the insecurity risk, which is also high, migration risks and existing migration, which of course is high as well, and a series of factors like these that all add up to get to the index. It's marked out of 10, and I think the worst was 9. One country achieved 9, and Chad and Nigeria both achieved 8.5.
So those are the indicators that has placed Nigeria in this unenviable position.
Unfortunately, yes.
Unfortunately, I mean, what do you think, therefore, that Nigeria can do to move out of that situation?
I think there's a lot of things that can be done. Some of the floods that we had last year were, as I understand it, avoidable because they were things like dams overflowing, which with better management of the dams maybe could have been avoided or at least minimized. With rivers overflowing, I think often it's a question of, with increasing population, people are often building homes and living in areas which are known to be flood risk and where perhaps you shouldn't safely build a house or be building a home if it's in a floodplain. But obviously there are also measures that we can take to manage flow of rivers and the way that they flood as well. That can be managed to a certain extent. But then again, natural disasters are, by their nature, often unpredictable. So it's not always possible. And certainly in the south, areas like Bayelsa, which at one stage I think was more than 80% underwater, the entire state, this is becoming a real big issue. So there are some things that we can do, and there are some things that are just impossible. I mean, I don't think we can stop Bayelsa getting covered in water when it rains very heavily, but we can help people to prepare for that and mitigate against the risks. Particularly things like having safe water and safe water treatment, so that you're not ending up living in, wading in, defecating in, and then drinking the same water that is all around you. So keeping safe water supplies and making sure that you have the means to treat them, I think would be my number one mitigation suggestion. And then toilets are another risk. If they are getting flooded and the contents is going into the water supply, that is another real risk factor that needs to be taken into consideration. So I think those would be my top two.
Mr. Kolawole, if we look at that situation, I mean, there's no guarantee that there won't be flooding again. I mean, it could happen again, and many cities could also go under the floods, as we saw last year, as we saw in 2012, for instance. With good town planning, be of any help in this direction? Because you just spoke about people building on floodplains and all of that.
Yes, that's actually one addition to what she has said. and that is that's a proactive thing. How do you plan the cities? How do you look at your hydrological setting as a city and know places that are very prone to flood and know what kind of structures and facilities should be there? How do you look at your town planning and know that there are waterways? Water will always find its way, and ensure that in planning your city, you either avoid or you put facilities that perhaps can benefit from water, if you like. So yes, urban, proper regional planning and enforcement of building codes, because some of what she said are clear violation of master plans and building codes. So they are there, they should be enforced, but it has to start from the beginning. Part of the challenges why most of these are third world issues is that most of the time we are very spontaneous in our planning. We just do not foresee that a river will one day overflood its bank, and people develop cities around that. So proper planning, and this has to be done in a holistic manner. First as a nation, and then you go to the states. Look at Bayelsa. Bayelsa, everybody knows, is prone. I mean, they are part of Bayelsa, you need to travel, they are going to Brass and things like that. What kind of city should have been planned in such a place and not have afterthoughts? So what we need is proper planning from the onset. And a major challenge why this is a difficult thing is the absence of data, hydrological data. Where are the places prone to flood? If the dam in Niger or Chad is open, where is it likely to get to? What do we need to do? What arrangement do we need to make, including interstate cross-border collaborations, so that you plan to prevent and mitigate, and then good early warning system. Because it's possible that, you know, this is, I mean, they do it all over the world. Hurricane is coming, there's nothing we can do. But we want the people to evacuate weeks before it happens, so that we can lose property, but at least we save lives. And lives is what is key, because with lives you can come and rebuild the communities.
All right. Well, let's take a short break. We'll be back to continue our discussion on the world water crisis. Stay with us. All right, thank you so much for staying with us on People, Politics and Power, and we are focusing on the world water crisis. On the 22nd of March this year, Nigeria joined the rest of the global community in marking the World Water Day. But that, of course, has thrown up a number of issues. How is Nigeria managing its water resources? And how is that impacting on the health of Nigerians, particularly children? Thank you so much, Dr. Bivan, for joining us. Now, according to a new UNICEF analysis, 78 million children in Nigeria are at the highest risk from a convergence of water-related threats. Nigeria is said to be one of 10 countries that carry the heaviest burden of child deaths from diseases caused by inadequate wash, such as diarrhea diseases. Now, tell us more about that analysis by UNICEF.
Yes, thank you for the question. So the triple kind of convergence, if you like, is poor access to water, also exposure to water-related diseases, and the risk of climate change. And as I mentioned before, this climate risk index analysis has already put Nigeria very high up on the index. But there's also, with the water coverage and with the high proportion of the population that is under 18 in this country, it really means a high number of children are at risk. It's spread all over the country, but I would estimate that there's more in the north of the country, because particularly of the extremes of drought and the flooding. But I think it's probably an issue everywhere in Nigeria that children are at risk.
78 million children, that's over 1/3 of our entire population.
That is correct.
Are there specific areas, regions, or in these states of the country where this is more prevalent? And if they are, what do you think is responsible for that?
Well, I think as we discussed in the south, particularly the coastal areas, flooding is a real issue, and saline intrusion from the sea is becoming more and more of an issue, so that fresh groundwater is becoming increasingly scarce. In the north, we have the very dry areas in the Sahel and the Lake Chad Basin, of course, and there the extremes of climate change are really visible in terms of prolonged periods of extreme temperature and drought, and then when rains do come, very intense rainfall and flooding. And this is exacerbated by the problems of deforestation, so there's very little cover and there's much more runoff of water, so less ends up soaking into the ground to replenish the groundwater. Beyond those two extremes of the country, I would say all areas along rivers are at high risk, and anywhere with low mean sea level because of the sea level rise problem and because of the rivers overflowing the banks. So I would say all along rivers, banks are increasingly high risk areas.
Mr. Bambo, let's begin to focus on solutions now. What is it that needs to be done and who needs to do what?
All of us need to do something. Everyone has a role to play in this. We always encourage that there should be government leadership, government at all levels. Various ministry departments must plan, but that planning has to be holistic. You don't take water out of overall planning. You have an inclusive planning where water becomes prioritized. And of course, with the climate issues, you now have to become more deliberate. One of the advocacy that is ongoing is the need for us to incorporate WASH-related data into current climate change strategies, policies, and strategies. That is not very clear, because when you now know you need to report on them, you need to track the data, then you have enough evidence to plan and then do better. That's the first thing to start with. And then the other, of course, is proper planning after the policies. Deliberate strategies. We have this data. We tell ourselves this data must change. What do we need to do? Do we need to get more funding, and not just more money, but deploying them in strategic areas that ensure that, for instance, if you triangulate this data, for instance, with the data of WASH availability in healthcare facilities, where the children are, in schools where the children are, you begin to see a link that several schools, several healthcare facilities have no access to clean water. So we have had cases where a woman is put into bed, there's a nurse with her, the other nurse has to go out to get water, baby arrives before water comes. And you can imagine that happening in very rural communities where the water may not even be within the premises. That will lead to infant mortality. And of course, there are also data related to levels of reporting of diarrhea infection within households. Children are vulnerable to that. What do we need to do to ensure that at that point of care, at that point of delivery, children are particularly targeted to ensure that in labor rooms, in what children have access to the best kind of water. Then when they get home, how do we ensure that we empower families and households? I mean, you use the water that is available. So if we want proper sanitation and hygiene to be practiced, we need to invest in, we have a hand hygiene roadmap now, for instance, that wants to encourage children and everyone to wash their hands regularly. Data has it, for instance, that you can prevent 50% of diseases by just washing your hands. How do we make this behavioral change go around so that from parents and families and adults, we can transmit to children, so that whether they're in school, they wash their hands at critical times so that they don't get infected. So we need to invest in social mobilization, invest in infrastructure to ensure that people have access to safe water, and we need to ensure, and of course these are the duties of state government. Service delivery is with state government and the local government where the people are. So we need to empower them, help them to plan and invest resources in a very, very strategic way. And of course, all of us, the private sector with innovations, because technology can be of use in this case. We need to invest in research that brings options that makes water and safe water available to prevent this kind of deaths.
I'm happy that you mentioned the local governments, because You and I, for instance, know that the federal and state governments appear very far from the people. So the local governments are the nearest to these people. And local governments in Nigeria do not appear to take some of these things very seriously. So how do we get across to these local authorities and get them to understand the responsibilities which they bear?
When we have this kind of conversation, again, it goes back to resources. So you have the local government stakeholder says, if we have the funds and resources, we will do this thing. So that's why I said our planning should be holistic. If you are decentralizing government to empower the subnationals, give them the resources to plan and to implement, you are likely to get more results. Okay, so it's a whole inclusive planning. At political level, decisions to be taken, socioeconomic decisions to be taken, and there are issues of demography to be taken. She just mentioned some places that are prone. They will need to look at them and invest more resources to support them, so that so those kind of things is a conversation we must have as a nation with all stakeholders on the table.
Dr. Bivan, how is UNICEF helping the Nigerian government to overcome some of these challenges?
Yes, so UNICEF works with the government in many different angles and ways, and I think probably the most significant one is in data collection. So really encouraging all states, and particularly LGAs, to collect their own data on WASH and to report that up through the region and then to the state and then to national level. And the ministry has been supported over the last few years to do what we call a routine mapping of all WASH facilities. So in fact, Nigeria has fantastic data on WASH. We know that's why we can say 67% coverage, because we know the data. And what the data is telling us is that coverage is stagnating to a certain extent, because we're talking in percentages and the population is rising. We're just effectively keeping up with population growth, unfortunately. So definitely data collection is one of the biggest areas I think that UNICEF supports the government. But also we're working in many states across the country, not in all, with different WASH programs, with the states, with the local governments, to really look at models of ways, for example, that facilities can be managed to better maintain them and make sure that they don't break down, so that people are all paying a tariff to collect their water, and that tariff goes towards regular preventative maintenance so that things keep going. If that doesn't happen, then pumps will get pumped and pumped and pumped and break down very quickly, and we've seen that happen. So it's why it's so important to really invest in the management, to invest in training mechanics, for example, who can go from pump to pump and repair these and make a living from that. And also in sanitation, because I think water and sanitation go hand in hand, and we're working very closely with the Clean Nigeria campaign, and so is WaterAid, to really make sure that we can improve the coverage of sanitation. So each state has a roadmap which is aiming to get them to be 100% open defecation free by 2030, ideally even sooner. So in all of those different areas UNICEF is working, but obviously that's just in water and sanitation. UNICEF works across the board in Nigeria with many different sectors, particularly health, education, the child protection area, for example, to really look after children of Nigeria wherever we can.
Mr. Banwo, as you know, Nigeria has perhaps one of the largest rates of boreholes. All over the major cities, you see people have to sink their own boreholes to get water. How is that impacting on the WASH program?
It's a two-edged sword, double-edged, because self-supply, that's what we call it, in the absence of public utilities
Public utilities
supporting.
Yes.
The statistics is that it's about 70% of self-supply in terms of people having to either dig their own boreholes or find other means. People need water. People must use water. So it's a major issue that talks about the fact that we have not invested sufficiently public resources, because it's better to have a big water scheme that is now piped and channeled to service homes and maintain the quality, the regularity. Yes, there will be tariffs, but you can always cross-subsidize the tariffs, so that, because again, we're always interested in the poor and the vulnerable. But there are places where they can afford to pay the bills. Then you use it to subsidize, so that the water is sustainable. If you don't do that, people will sink borehole. In terms of the empirical and scientific implication of that for our earth, for the geography and the geology, I remember there was a time we had a blast in Papi, and there was speculation that this is a result of multiplicity of borehole. Okay, we are not able to substantiate that. In terms of that, a lot of research needs to be done. And one of the conversations that we are having with some of our partners is perhaps it's time to do a research on what impact that has. But in terms of water availability and access, there's not much that can be done, because people will find a way of having water. Now you have huge estates coming on board. You'll be surprised, you go to some estate, each of the houses have their own borehole within an estate of 200 housing units. What does it take to have a plan, to even if you have a water and treatment plan for that estate, as a way of ensuring that you don't have multiple boreholes? So,
because even water from these boreholes are not treated.
No, they're not. We can't. I mean, water quality is presumptuous. Okay, there's a myth that water from the borehole is the safest, but who knows about the iron content? Who knows about the sanitation around, whether it is infiltrated? Nobody tests those water. People just take them in and use them. They believe it's safe. They may not be safe. And water quality testing, the rule is that there should ideally be a process for sinking a borehole if it must be sunk. And again, it has to be government regulated. In many places, you need a license to sink a borehole. And they need to be sure that there's no borehole within certain perimeter and distance before you are giving the permit. Over here, it's just very indiscriminate. And it is just proliferating everywhere. I think one of the proposals I wanted to make was perhaps one of the things that we can do with the Population Commission is that as we are doing housing census and people census, maybe we include data around borehole census, so that as you go to a household to count, you find out, so that we can also have an idea of how many boreholes we have as part of the census process. Unfortunately, I've not been able to advance that to a point where I think it can be taken, but the census is near. But we need to have data on that, and then know the implication for us, so that places will not begin to sink and whole communities go under, because we have destroyed all the superstructure underneath from the water table up that holds the thing and make sure it is firm. It's a major danger, it's a risk, and we discourage it. We discourage multiplicity and proliferation. We encourage development of water schemes, public utilities, efficiently managed, that can ensure sustainable and reliable supply of safe water, because then you can treat, you can test at every point to guarantee that the quality is okay, because you need to do periodic testing, because anything can happen along the line. But when they are proliferated and are in people's homes, you never can tell what kind of quality water they bring and who will drink it, and what infection and outbreak can result from a single borehole. It could be cholera, and then it spreads, and everybody just for one borehole. So we need to focus on it, regulate it more, but honestly put an end to it by encouraging government and stakeholders to begin to think of those water schemes that can serve hundreds of households. Collect the tariffs. At least if you don't make profit, there should be cost recovery, because you need money to continue to treat, to continue to pay the workers that keep it going, and to continue to ensure that the pipes are maintained.
Dr. Abiba, what would be your last word on the World Water Day? What are the lessons to be learned from all the data that UNICEF has gathered?
Well, I think the two key points for me are about investment. As I mentioned before, I think we're not investing enough in water schemes and services for the country. That is why people are reverting to self-supply. And the second one is about sustainability. So it's about maintaining the systems that we do have. Rather than just building new ones, let's fix some of the old ones first. And for example, the water utilities across the country, the norm does show that most of them are not operating at their full capacity, so there's a huge amount more we could be doing there to be providing more water for cities. So those, I think, are the two areas. And finally, I'd just like to say, let's us all be the change and really do our own little bit for water conservation. Thank you.
Thank you so much, Dr. Jane Bevan is the UNICEF Nigeria Chief of WASH, and she's been joined by Kolawole Banwo, who is the head of advocacy, Water Aid Nigeria. Thank you so much for your time.
Thank you.
All right, that's our program for today. Please join us again. We'll bring you a fresh edition of People, Politics, and Power.